Hello, this is Sheik Sadiq. Today we will perform the examination of sensory system and reflexes. The first is a testing for pain. Use a sharp safety pin and touch with it on the patient's skin and ask the patient, is this pain sharp or blunt? And after doing the test, dispose the pin safely and don't use it to the other patient. Now we are going to perform the light touch. With a fine cotton, touch the skin lightly and avoid pressure and ask the patient to respond whenever he feels the test. During this test, ask the patient to close his eyes. Next, we are going to perform the vibrations test. We are going to perform vibration test. Use a low pitch tuning fork of 128 Hz and tap it on the hand and place it on the interpharyngeal joints of the patient and ask whether the patient can feel it or not. In this test, grasp the big toe of the patient and hold it with your thumb and move it up and down and ask the patient whether you are moving up or down and repeat the same with the fingers also. During this test also patient should be closed his eyes. Next test is discriminative sensation test. As it depends on the touch and position sensation, they are useful only when these are intact. And our first test in the discriminative sensation is stereognosis. It represents an ability to identify an object by feeling it. So place a familiar object in the patient's hand while his eyes was closing and ask the patient to identify the object. And the next test or the second test in this discriminative sensation is GRAPHESTHESIA. In this, write a number or letter on the patient's palm and ask him to identify the letter. Now we are going to perform 2-point discrimination test. Using two pins, touch the patient's skin in two places simultaneously, alternating the double stimulus irregularly with a 1-point touch. Find minimal distance at which the patient can discriminate one from the another. Reinforcement technique. If the patient reflexes are symmetrically diminished or absent, perform this. In this, ask the patient to lock the fingers and pull just before you tap if the reflexes are not clear. Going to perform or check for the bicep reflexes. In this, tap on the bicep tendon and observe the flexion at the elbow and watch for and feel for the contraction of the bicep muscles and perform the same with the other hand. Next we are going to perform the tricep reflexes, tricep tendon reflexes. For this, tap on the tendon of the tricep and observe for the reflex of this tricep tendon. Now brachioradialis reflex test. In this test, strike the radius at above 1 to 2 inches from the wrist and watch for the flexion and supination of the forearm, and same perform with the other hand. Now perform a test for the ankle reflexes. Strike on the Achilles tendon and watch for the plantar flexion of the uh, ankle, and also note the speed of relaxation of muscles. Next is a patellar reflex test. Tap on the patella and watch for the reflexes. Next, perform a test for the ankle pronus. Support the knee in partly flexed position with your hand, and with other hand dorsiflex and plantar flex the foot. Do the same with the other foot. Test for the abdominal reflexes. Test the abdominal reflexes by lightly stroking on the abdomen above and below the umbilicus. Note, note the contractions of the abdomen. Plantar responses. With a stick, stroke lateral aspects of the sole from heel to the ball of the foot, curving medially across the ball. Use light stimulus for provoking responses. I have done with the examination of sensor system and reflexes. Thank you.